Hello, and welcome to the new Aloe Vera study webinar sponsored by Desert Harvest. My name is Lee Lowry, and I am the Executive Director of the Interstitial Cystitis Association. Thank you so much for joining us today. Can you put my slides up, Nikki? Before we get started, I'd like to share a little bit about the Interstitial Cystitis Association. Also known as ICA, we are the only nonprofit charitable organization dedicated solely to improving the quality of healthcare and lives of people living with IC. Today's event is one of 4 events we are offering during this IC Awareness Month, which will cover awareness, research, and education. One of our 4 events this month is our first ever virtual awareness walk, which we are kicking off today. Join IC patients across the country for a free virtual week-long event filled with new information from top IC clinicians, self-care tips, and daily challenges. Check out the link on the slide. Another Eye Care Month event is this study. On September 10th, we helped our partner Beaumont Health Systems launch an important study that aims to develop a definitive diagnostic test for people living with IC. We are encouraging all of you to enroll in this study that could have an incredible impact on the IC community. It's very simple and free to participate. Find details for participation at icstudy.org. A third Eye Care Month event is a free pelvic pain symposium where you can learn about the newest research and clinical progress for pelvic pain. On September 26th, ICA will co-host this webinar with Northwell Health, and it will be moderated by ICA board member and Medical Advisory Board member, Dr. Robert Moldwin. And finally, here are a few more just excellent resources that you can access through ICA's website and our social media channels. Okay, so today's webinar is about a new aloe vera study, and it's sponsored by Desert Harvest. So now I'm going to introduce you to Desert Harvest Chief Executive Officer, Heather Florio, to get us started. Heather is the, oh, hi Heather. I'm gonna just introduce you real quick. Okay. Heather is the 2nd generation owner of Desert Harvest and has been an integral part of its operations since 1993. In 2012, with the retirement of her parents, Heather took over as CEO of Desert Harvest, bringing not only her management and operations skills, but her passion for helping, advocating, and educating with her vast knowledge on interstitial cystitis and women's health issues. So go ahead, Heather, start us off.
Thanks for having me, Lee. I really appreciate the ICA allowing us to launch our study this way and get this information out to the IC community. For those that don't know Desert Harvest, we've been around working with interstitial cystitis patients since 1993, providing nutritional supplements and skincare products that can benefit or that are IC friendly. We started with our initial product, which is our super strength aloe vera capsules in 1993. We developed a patented formula that we still use today and use in every single one of our products. And after this webinar, you're definitely welcome to visit us to learn more information about Desert Harvest on our website at www.desertharvest.com. And what I will do now is introduce Dr. Evans. He is our amazing doctor from Wake Forest Baptist Health here in Winston-Salem, North Carolina. And he will be heading up this study. And Dr. Evans, I'll let you take it from here and tell him a little bit about our study.
Well, good morning all, and thank you, Heather, and thank you, Lee. It really is a pleasure to have an opportunity to be involved in this webinar. I'm just sorry for those of us that were supposed to be out walking today that COVID has taken that away, but we certainly can hope that in the future we can get back to having our walks in reality. But I am excited for the opportunity to talk to you a little bit about this trial that we're hoping to accomplish. But before I give some of the inclusion and exclusionary criteria, I sort of wanted to share with you a little bit about what we're hoping to accomplish by getting some more information about the efficacy of the Desert Harvest product. Because what we're looking for our IC patients is the following. Number one, we would like products that actually work. okay? If you take a medication, it has to do what you ask it to do. So we're looking at efficacy. The second thing is we want it to be safe. We need a product that people can take long-term without significant side effects. So we look at safety questions. And the third is that we want something that is available to patients. It's easy to access. And my hope, and we're going to demonstrate that the Desert Harvest product hits on all three of those. So for those of you who may be interested in potentially participating, let me go over you a little bit about what we're looking for. And so the first thing is this is open to both men and women. Like most studies, it's required that you be at least 18 years old because we just can't really let our pediatric and teenage patients get involved just due to the need for informed consent. Anyone who is a female of childbearing potential has to use some acceptable form of birth control, and that could include having had a hysterectomy, having had a vasectomy, or any other oral birth control pills, etc. Again, that is standard for every drug trial. We do ask the patients to have informed consent, so we're following the strict requirements for a proper trial and controlling this through our institutional review board. So we're looking at all the potential safety ramifications. To get into the study, you have to have urinary frequency of 11 times in a 24-hour day on average over 4 weeks. Now we know that some people have good and bad days. That's why we average this out. But for those of you who are reasonably well controlled and only voiding 6, 7, 8, 9 times a day, you're probably not the folks for this trial. That doesn't mean the medication wouldn't be helpful for you, and you certainly can get it, but it's not, you're just not a proper participant for the trial. We also are looking to have pain scores of at least 4, okay, on a 0 to 9 scale. It's called a Likert scale. It's a very common thing that we utilize in medical trials. And so we want a pain score of 4 or greater. The main reason for that is if someone is walking around with a pain score of 2 and they drop down 2 points, that's not doesn't look like that much. So we need someone who actually has fairly significant pain. And they have to have had pain for at least 24 weeks. And again, that's a standard IC treatment requirement because it's part of the definition. So if somebody has only had symptoms for a month or 2, they're really not a candidate for the trial. And we do want them to give us a voiding diary. And we want to at least on one occasion have a 75 cc void. Again, if someone has got a bladder that's so small that they can never even hold 75 cc's, it's going to be hard to decrease their frequency simply due to the fact that the volume is so small. So these are some of the exclusionary criteria. So let's assume you are over 18 and you hit the numbers in terms of frequency and pain, and you've had this disease for 24 hours, 24 weeks, and you're willing to sign a consent. These are what we call exclusionary criteria. So anyone who's allergic to aloe, obviously if you're allergic, you can't take this. We don't want anybody who has bladder cancer, even a history of bladder cancer, or a stone in the bladder or the urethra, because obviously those will cause irritation to the bladder that may not respond to treatment. Any form of cancer within the urethra would also be an issue. Anyone who has been exposed to things like Cytoxan, that is a chemotherapeutic agent that's known to irritate the bladder and can cause confusion with interstitial cystitis. The same for people who have had radiation to their pelvis for a gynecologic or a urologic condition, because again, radiation cystitis can confuse the IC symptoms. Anyone who has a urethral diverticulum, anybody who is unable to urinate, anybody whose IC symptoms are alleviated on their current regimen. So if you are doing well on whatever medication you're on, you wouldn't qualify because you're not going to have enough score in terms of either pain or frequency. But if you're doing well, we don't want you to necessarily come off. We're looking for folks who are not doing well. You can enroll if you're a diabetic, but not if your diabetes is out of control, because obviously that in and of itself can cause frequency. We're trying to play this really straight. We don't want people who've previously been in an aloe vera study. Sometimes you'll see studies that bring people back who responded well. That's kind of cheating. We don't want to do that. We want to do this the right way. So if somebody has previously been in a study or used the Desert Harvest super concentrated freeze-dried aloe, we're going to keep them out. We'll encourage them to continue with the therapy if it's working, but they won't go into the study. And we're also want to make sure that if anybody is about ready to make a move where it will be hard to get follow-up, like they're leaving the country or moving to another part of the country, we're going to probably exclude those. And then, of course, anybody who's got substance abuse problems or dependency issues for alcohol or narcotics, et cetera, they're not going to get in as well. Now, I did mention earlier that men are allowed in, and the only real thing that we have to avoid there are prostate problems. That would be prostate cancer or prostate infection within the last several months. If you have completely treated prostate cancer 5 years out, that would be okay. And if been no infections in the prostate for 3 months, that would be okay too. And you know, the last exclusion is you can't do this if you're pregnant. Obviously, that's true for any drug study that there are. Now, if you do have a problem that can be fixed, say a vaginitis or something like that, or you've had some recent surgery, we can defer you until you're far enough out from the procedure. So say someone that had a hysterectomy or prolapse surgery, we can defer for up to 24 weeks, and hopefully the study will still be running at that point. If people have had things like a positive urine culture, we have to clear that and then wait about 6 weeks. If anyone has had herpes, we have to clear that and wait about 12 weeks. And anyone who's had recent cystoscopies, urethral dilations, anything that could confuse our data, we want to wait at least 6 weeks for that. And anybody who's on another investigational trial for another medication that would affect IC, they would have to be deferred. Anyone who's had recent DMSO or bladder installations has to wait 12 weeks. So for those who are doing a lot of bladder installations, if you are interested in the trial, you better stop now because you're going to need to wait about 12 weeks. Anybody who's had Botox injections has to wait 24 weeks to make sure that's completely worn off. Anyone who's had any form of recent incontinence surgery, I think I mentioned that earlier. So those are all the things that are the exclusionary criteria, but reality is that it's actually a relatively simple list. I mean, these are people who have these other illnesses such as radiation cystitis clearly don't want to be enrolled. And if you have had something that would confound our data, if you can simply wait, depending on which treatment it is, 12 to 24 weeks, we're still very happy to get you enrolled. The goal right now is to get close to 100 patients enrolled. We may be increasing that depending on what kind of feedback we get from the FDA, but it's going to be a relatively simple trial. And I think that we had discussed earlier, there even may be a way for some folks to try to do this after an initial visit to do a lot of things virtually. Now, I've got one question that just came up. Is can you join the study if you're on Elmaro? The answer would be yes, as long as you leave your dose the same. And so people are going to, in essence, function as their own control. So if you are on standard dosages of Elmaro, hydroxyzine, amitriptyline, et cetera, non-narcotic therapies for IC, other than instillation, but oral therapies, they can stay. Now, another question just came up that said, what if you're on Aloe Vera? The answer there would be no. If you're already on Aloe Vera, you can't go in the study.
And I think with regards to the Elmaro, I think we had said in the exclusionary, I've got to double check. I think it was that they had to have been on the Elmaro, a stable dose for a minimum of 6 months.
Yeah. As long as I said a standard dose is not changing. Okay. One just came up, something said that could you join if you're from Canada? Sure, that'd be fine. You just got to find your way to North Carolina at least once to see us. The next question said something about hydrodistension every 4 months. Actually, you would not be able to enroll because you would have to wait 6 months. I think it was six months from a hydrodistension. No. Okay, sorry. You could do that if you could wait 12 weeks, but then you would not be able to get another one. So that would not be allowed. And here's one that just says, can we join in the study if we're not currently in an IC flare? It doesn't matter. I mean, it matters what your numbers are to get in. You have to have 11 voids and you have to have a pain score of 4 or higher. And so, if you're not in a flare, but your baseline is there, then that's fine. that will be okay. You have to meet those entry criteria. Now, something just came up about, do you have to come to North Carolina? You know, we had not really actually thought about whether we were going to have people allowed to do this completely virtually. That may be possible. But we have not discussed that. So I would say, yes, you probably have to come. But, you know, our practice is used to seeing people from all over the United States. We can handle folks from out of state pretty easily. And I think once they're enrolled, we certainly could, I think, deal with just about everything in an online fashion from that point forward.
Yeah, with the evolution of COVID, I think we're going to be able to definitely evolve this with telemedicine. Probably we'll just have to.
Yeah, I think a telemedicine visit might work. I mean, that I'll have to check and see if the Institutional Review Board would have any issues with that. If they've not had an exam by me, I'm not sure about that, but I think that we could potentially do this. And I saw somebody just mentioned telemedicine is great. You know, for a lot of our patients, I would agree. I'm still a little reluctant to do a initial evaluation of an IC patient by a telemed because I'm really very focused on the exam to make sure they don't have other problems, whether it's a urethral problem, a pelvic floor problem, that may be the principal problem or just maybe secondarily, maybe a secondary issue that still has to be managed. Because a lot of our IC patients do have pelvic floor problems or whatnot. But once I've got an established patient, I think the telemedicine visits are great, particularly for folks who have to fly here. I mean, it saves them a tremendous amount of money. One thing that you may all find of interest for those of you who do use telemedicine is that a number of states are starting to, what I would say, crack down on this because they're now indicating that if we're seeing somebody on video and we don't have a license in that state, that we're now doing something that they say we're practicing medicine in their state without a license. I really don't see that that's true, but it is something that I think is going to potentially screw up some of the benefits we've achieved from telemedicine. We're hopeful that somebody at Congress will pass a rule that allows that to stay available for folks who are across state lines. So this says, I see urologist in Michigan. Can't you help me get enrolled? No. This is a single site study right now.
And we do have someone asked if they can join if they're taking 60 milligrams of Cymbalta a day.
I'm sorry, Heather, what did
60 milligrams of Cymbalta a day. They want to know if they could join.
Yeah, that's not a problem as long as the dose is stable.
And let's see what some of these other ones. We've got an Australian here that wants to also wonder if he can enroll. So we'll have to international if we're able to make.
Yeah, we'll. You know, this is not something we'd actually anticipated that folks would want to enroll from a distance, but I would be very open to trying to do that as long as we could get some form of confirmation from an outside urologist that all the inclusion and exclusionary criteria were met. Okay, the reason that you can't be in the study if you're already on aloe vera is that really is, in a way, is kind of cheating the study. So let me see if I can give you an example. Let's say that we think that 8 out of 10 people or 7 out of 10 people are going to respond. And so some people get the medication, some people get a placebo, and we can see the difference. But if we give it to people who already know they respond, it's really gives false data. It's called enriching the pool, and it's very frowned upon. So no, you can't go in the study. And honestly, I don't know why you would want to go on the study because there is a chance you're going to get a placebo in the study. That's the only way these things work. So if you're responding well to aloe, please don't give it up. Stick with it. You've already proven you respond.
Another one is, what about an Interstim implant? Yeah,
Interstim is fine as long as, as long as you don't adjust your settings. Okay, you have to stay on stable settings. So if you have the older device, that you just have to leave the settings alone. If you have one of the newer devices, you have to make sure you keep it properly recharged, but we don't want any switching around on programs or any changing of the kilovolt settings. It needs to be left alone for the duration of the trial.
And then we've got, do they need documentation from their current urologist that they indeed have IC before visiting you?
No. I mean, I can figure that out. No, I mean, it'd be nice. That would be great, but, you know, no, not necessarily. We do allow people to self-refer all the time.
I can take this one on a little bit. So David here says he took a bottle of Aloe Vera 2 years back. Gastrointestinal irritability forced me to stop. Would it be advisable for me to participate? It has been long enough since you took the Aloe Vera. The gastrointestinal irritability could be due to a variety of things. It depends on what aloe you took for one, David, and because the aloe naturally has several ingredients in it that we actually remove in our patented process that can cause gastrointestinal irritability. So that will definitely be a question of what type of aloe you took 2 years back. Sometimes people can be sensitive to a high nutritional content, and that's where we advise adding a calcium supplement to kind of reduce any acidity that might be bothersome or cause any gastrointestinal. We usually utilize a calcium and vitamin D3 in that situation. And that would be my recommendation on that one. And then Marlene is asking, the purpose of aloe vera, is it for pain treatment? And so I'll let you kind of go into this, Dr. Evans, but we are looking at all of the symptoms.
I think this is really important, just almost as a philosophical question. I always tell patients that some treatments are designed to treat the underlying condition, and some treatments are designed to treat a symptom. This is actually not designed to treat pain. It's designed to treat your bladder. And if your bladder gets better, your pain and frequency should improve. But unlike, say, a narcotic that doesn't fix things and just masks the pain, this is actually designed to treat the underlying condition as best we understand it. So while clearly the fact that we're asking you questions about pain would indicate that we think it's going to help with pain, I would not consider this a pain treatment. I would consider it an interstitial cystitis treatment that just so happens to help to decrease pain and frequency. There's one question that popped up there. I know we're getting a little backed up on some of the questions, but it said about other supplements. And the answer is, I don't think there's any reason that if you're on a stable supplement that you cannot take this. Again, it's just like your other prescription medications. If the dose is allowed to stay the same, you can leave it alone, because if it was really all that great, you wouldn't have a pain score of over 4, and you wouldn't have a frequency score. So I think that as long as you leave things alone, that would be fine. One question just popped up saying you thought that it might work better for patients with Hunter's ulcers. And the answer to that is that I don't know if that's true. I don't see any reason why this can't work for non-ulcerative patients. You know, we're learning a lot in our lab about the genomics of this, and Hunter's ulcers patients are a little bit different, but in our lab, actually what we've learned is that it's not just Hunter's ulcers patients that are different. It's patients with extremely low capacities. That is a different group. And so my bet is that, honestly, I suspect the other patients may actually do better, because if you can calm their bladder down and decrease some of the pain, they have enough bladder volume to be actually able to really decrease their frequency. Whereas unfortunately, a lot of the ulcer patients have had scarring and shrinkage of the bladder, and sometimes their frequency is not quite as responsive simply due to the volume that they have to hold urine. They just have much smaller bladders.
Then it looks like we have one question here about whether the trial be posted on clinicaltrials.gov. It is being registered right now, so yes, it will be. And then what research design will be used?
I'm sorry, what research what?
What research design will be used?
Well, I'm not sure what they mean by research design. It's a double-blind placebo-controlled trial. I mean, it's a standard clinical trial that we do for any medication. and you know, we have, there's some crossover involved, so the patients get access to the medication later on in the study. So for those who got placebo, will get the real drug eventually. If there's more specific questions about design, we can perhaps go over that.
Okay. I think that's actually Dr. Buffington. So if you are still on, you are welcome to email me, Dr. Buffington, and I can connect you with Dr. Evans as well. And then next one is silver nitrate treatment. They want to know if that would be
okay. So I will preface this by saying I'm almost astonished that anybody receives silver nitrate treatments, because the AUA guidelines have emphatically stated for several years that those should never be given, because they really cause a lot more trouble than they do. But we would treat that the same way I would a hydrodistension or a bladder installation of any kind. And so let's see, for the hydrodistension, it's 12 weeks. And I think from installations, I'll double check. I think it may be 6 weeks. And so they would have to be off of that for that period of time. And then off of it, certainly for the duration of the trial.
Okay. The next one is methamine, 500 milligrams 2 times a day.
I'm sorry, what was that medicine?
Methamine?
Methenamine?
Methenamine.
Yeah, that's not a problem. That's just prevention of infections. That would be fine. There's no issue with that. Again, like any other medication, if something comes up that you have to change your dose, you have to drop out. You know, because if you change the dose of anything that you're taking and all of a sudden you do either better or worse, we're going to blame it on the product, but it may be because you just changed your medications. So no, we can't let any dose changes. But again, if people stay on the same dose, they function as their own control, and whatever benefit they accrue would have to be due to the study drug, in essence, the super concentrated aloe.
And then do you consider eosinophilic cystitis a type of IC?
Okay, eosinophilic cystitis patients cannot enroll, although I will tell you that there's such similarities between eosinophilic cystitis and IC that I think there's a strong possibility that they could benefit from this, but we need a formal IC diagnosis for the trial. And again, there may be minor differences there that just would be an issue in terms of enrollment.
And I'll take this one. So Caroline has asked, do I take the the aloe by mouth? Is it injected? Is there a cost? There's no cost for this study. And in fact, the course of the study is total about 6 months, 6 visits in total. And with that, you will get aloe each month. Or in some cases, those that are randomized will get placebo, but you also get afterwards, depending on whether you got placebo or not, you will receive either 4 or 6 months of additional aloe free after the trial as well.
I just saw one question. Okay, so it's in one location right now. It's in Winston-Salem or Greensboro. I have offices in both locations in North Carolina. Another question, somebody asked about what medications are good for interstitial cystitis. I really can't get into all that, but what I would suggest may be worth doing for you is to, you can actually go to the American Urologic Association and go to the interstitial cystitis guidelines, where they actually go through the data very carefully in terms of what's available and make some recommendations, but we really can't do that in this format.
And I've got Anne here who's asking, I have pain and discomfort after eating very little food that I can safely eat. If I do not eat, I have very minimal symptoms, though I have frequent urination anyway. Am I eligible? My urologist has told me that my bladder itself is healthy.
You're eligible if your average pain score is 4, and if your frequency score is 11. I mean, that's the only requirement. But you know, we are looking for people who have pretty consistent, pretty steady pain. You may not be that person, but what I would say though is that proper treatment of your IC may allow you to be a lot less dietary dependent and make it a little bit easier for you to eat other things other than following on this incredibly restricted diet. So, I would say that while you may have a hard time qualifying, if your scores are not averaging out at the proper level, that doesn't mean that you might not benefit from the product.
Oh, and this is a good one, Dr. Evans. They want to know how, where they contact, where they go, if they are interested in getting more information about this.
Yeah, I think that the best thing, I'll give you the main phone number for our office, which is 336-716-4131. And if you would, please don't call today or tomorrow, okay? Because I have to make sure that I've got something prepped for this. But if you ask to speak to Tammy, that's my personal triage nurse, she can help get things set up. And we're going to set up special slots every day for patients who want to participate in the trial.
And I will take this one. Anna is asking, she has been taking Desert Harvest Aloe for 6 months and she's doing well. Is there any recommendation on how long it should be taken? So in our 27 years, this isn't obviously, it's not curing your IC per se. If you stop taking it, the symptoms could very well return. And so what we do have, however, on our website, we do have a whole dosage protocol on our website. And part of that lists a maintenance dosing program in which we will actually be doing in the study, where we will be maintenance dosing down the last few months to see, because everybody is kind of in a different range on that maintenance dose, and that will be part of what we will be studying in this study. But if you want to look on our website and follow that dosage protocol of maintenance dosing down from the 6 a day or whatever you might be on at that point, you are definitely welcome to take a look at that. And if you have any questions, you can call us during Monday through Friday at 800-222-3901, and someone can kind of guide you through that.
One question that just came up said about pay for travel, and the answer is no. There's nothing in the budget to pay for travel. Again, we would try to do some of this stuff via video. Some of the visits could certainly be done that way, but an initial evaluation, I think you would have to establish yourself as a patient in our practice. And again, that is for me to be able to be absolutely sure there's nothing else that you need.
Okay. Oh, we have had a request to repeat the phone number again, Dr. Evans.
Yeah, sure. Here, I'll do it again. And Nikki had put this up as well. So it's area code 336-716-4131. And then you'll get different things. You want to get the triage nurse, and you want to ask for Tammy, Tammy.
Perfect. And let's see. Shannon, so we did go over earlier, she was asking, she's a nurse practitioner in Greenville, South Carolina, who specializes in IC, and she was asking any IC diagnostic criteria in order to enroll. If I diagnose IC patients with IC by exclusion and PUF, is it okay to encourage enrollment?
Yes. Yeah, there's not a requirement you have to have a cystoscopy and a hydrodistension. And honestly, any nurse practitioner, PA, or urologist or urogynecologist who are involved in IC, and they believe that they've established it, because as you know, this is a diagnosis of exclusion. The only requirements, according to the American Urologic Association or the Society for Urodynamics and Female Urology, or most of the United States organizations, is that you have pain urgency frequency of 6 months duration. Pain has to be coming from the urinary bladder, and there has to be no other concomitant source. That's why we have to exclude cancers, radiation, cystitis, herpes, all those things we mentioned. But if you've excluded all those and you have the symptoms and it's lasted 6 months, there is no requirement for a cysto and hydrodistension. So this can be made on clinical grounds, and we'd be happy to enroll you.
And Anne, I will, she's asked me to repeat our 800 number again. So for you, the 800 for Desert Harvest is 800-222-3901. And Dosage. Amy is asking about dosage. So the dosage is going to vary throughout the study. The protocol will start with the traditional 6 a day, and then there will be an escalation protocol as well as a de-escalation protocol that will be being followed throughout the study. So your dosage will vary throughout those 6 months. And let's see. We have Christy who is asking, I see a urologist in Edenton, North Carolina, monthly for installations. I realize I have to go 12 weeks with no installations. Am I appropriate with all the other qualifiers then?
Yeah, I would think so. If you can, manage to go 12 weeks without an installation, if they're, but you would have to be off it. You have to be off it not only for 12 weeks, but for the duration of the trial.
And Alyssa here is asking, is endometriosis an exclusion criteria?
That's there's sort of a soft call there because it says any disease which in the opinion of the investigator may have a bearing on the outcome of the study. So something that would make it difficult to tell if the pain is if you can't tell that the pain in question is from the bladder versus the endometriosis, we would probably not enroll you. We are looking for people with bladder-based pain. I mean, if you've got significant endometriosis, you're really going to confound the data. So that would not be, you're not an ideal participant.
We also have one that's asking about vulvodynia.
I mean, that's the same thing. It's sort of a blanket statement. If you've got another significant source of pelvic pain that could confound our data, then you're not going to be really a good person to be enrolled. So this is the basic issue. Let's say we get, you've got pain that's 6 or 7 out of 10, and it's hard to tell how much is bladder and how much is your vulvodynia. And you take the product and your bladder gets better, but you still have this ongoing vulvodynia that causes you to have a high pain score. And it doesn't look as if there's been much of a change in your symptoms, but maybe your frequency gets better because your bladder's better, but you still have ongoing pain. So if you honestly answer your scores, you're going to still have a pain score. Well, you've now confounded the data because you're actually talking about a different source of pain, but there's so much overlap there, it makes it difficult. So we would probably prefer to not enroll you.
I'll take this one. Carolyn is asking, are there any known side effects from this? Part of this study will be studying that, but I can tell you that in our 1995 study and in 27 years, we have had no known side effects at this point. This is all natural. We do not add any chemical ingredients or even the capsule is a vegan, all natural capsule as well. So.
Yeah, one of the things for those who've never been involved in a clinical trial, there are what are called adverse events, and then there's what are called serious adverse events. And so there's never been a trial in which adverse events don't come up. But the interesting thing is in a lot of cases, it's the same for the placebo group. So if somebody says, I had a headache, you write that down as an adverse event. You don't know if it was true to the drug. We actually try to determine that if we can. But then if it all shakes out that the same number of headaches in the two groups, you realize it's probably not of significance. Serious adverse events are, hospitalizations and heart problems and significant issues. And I will be astonished if we have any given the previous track record with this product. But we monitor everything so that we make sure. Honestly, when you're in a clinical trial, it's probably safer than being on the medicine on your own because you've got people monitoring you, on a daily basis in essence. So it's generally a pretty good thing to be in a trial. You're very, very carefully and cautiously monitored.
Anne has asked, I have pain above 4 if I eat the wrong thing. Does this make me eligible?
Well, it's what your pain score is on a daily basis. And so if you say, if I follow my diet, my pain score is below 4, then you don't qualify. And And if you say that you're paying, because we expect people are going to do the usual things that they do. They're going to take their medications. They're going to follow their diet. We wouldn't tell you to go ahead and eat bad foods to make yourself worse just to get into the trial. That just doesn't make a lot of sense. We're trying to take you as you are on your regular basis. And if your pain score is over 4, then you get to go in.
And then, Jenny, you had asked about coupons for Desert Harvest on a regular basis. It looks like you already take it. We do have, and I see your hours have gotten cut at work. So definitely, we do have a variety of programs that are available in coupons and other things. You are welcome to, again, call that 800-222-3901, Monday through Friday, 8 to 5 Eastern. And someone can see what would work best for you and qualify. We're definitely all about making sure that this is available for everyone. So definitely give a call. Janice is asking, I take Eliquis to prevent blood clots. Would I be eligible?
Yes, there's no contraindication for blood thinners.
Okay, perfect. And Janice had also asked about the telemedicine. You couldn't travel to North Carolina. Earlier we said, and I know we have a couple of people asking about the virtual and the travel. We just keep an eye, one on either following us on our website on Facebook or the ICA. They will also post this information. Once we can determine the initial visit would have to be, it sounds like an in-person visit, but we potentially might be able to make the rest of it work with telemedicine, but that will be determined here in the near future. It will be posted.
Yeah, I mean, there's some logistical issues having to do with randomization and having to do with medication allocation because, we have to make sure that we do this properly so that nobody knows what they're, are they getting placebo, they're not getting placebo. And the logistics of doing that via telemedicine, that's not that easy. I'm not 100% sure that that's doable, but I'm willing to consider that in this COVID environment.
Yeah, with this world, things are changing, so we never know, but we will post if we are able to do that, and the ICA will post the information.
Two questions have come up that I've noticed. One was a spinal stimulator. Again, if your spinal stimulator is knocking your pain below 4, you can't enroll. If it's not working that well, then you could enroll. There was another question about where will we publish this? And the answer is, well, it depends. Depends how good my study is, depends how good my paper is, and who likes it. So, I'm pretty routinely published in Journal of Urology, Urology, it's the SUFU, Neurodynamics and Female Urology. I forget the whole name of that. British Journal of Urology International and Canadian Journal of Urology have been published in all of those. So, we'll see how important the data turns out to be and what our response is. But we do intend to get this into a decent high impact journal.
So Roberta said that you cannot swallow capsules. So the one good thing about our capsules is that you can open them up. It's a inside of capsules. You can put them in food. You can put them in drink. They're not going to change the nutrients. They're not going to have an effect on the nutrients of the aloe vera capsules. So that is one thing that is nice about our products if you cannot swallow capsules. Let's see, I think we have two pages, so I'm kind of going back, and this one takes Elavil, 25 milligrams a day, and wants to know if that would allow her to qualify.
I can go a couple that came up on Q&A. One is from Tony Buffington, and we do know about the desire to try to get to 100 patients per group, and we have talked about trying to push our intended number up to that level. I mean, honestly, some of that it may be on a cost basis, while we may not be able to get to that level, but that would certainly we have had some discussions along those lines. Next to the question, can aloe be taken on a symptomatic basis? The answer to that is yes, and I do have some patients who do that. The other thing that happens is that some people start out on a full dose regimen, and as they get better and better, back it down to doing this just on a on more of a PRN basis for flare-ups. There's a question about if you can't join and say want to try the product, what do you suggest you start with? I think the usual standard starting dose is 6 pills per day. That's a good place to start. And then there's a question that says, how long will it take before they've analyzed the patient's reaction? It depends on how fast the enrollment goes. But I wouldn't expect to see any of this data available for at least a year because people are going to be on this long term. And it's a pretty long-term study. So, you know, when will we have this data available for publication? End of 2021, maybe, depending on enrollment, maybe into 2022, somewhere in that time frame.
I think we've covered. There is, you know, Pam, you'd asked how long the study will last. That will last approximately 6 months in total. Let's see if there's any others that we haven't answered yet. Let's see. I realized. Oh.
I just 1 or 2 questions here. Somebody made a mention that they've been taking 6 capsules of the aloe. It's changed their life. That's a good thing. We hope to change a few more lives with this study. Another one that says, I'm taking 12 a day. Is this too many? I mean, I can defer to Heather, but I would say no. We have people that take that many, and since it's really a pretty safe, all-natural product, we've not seen problems. So I think it's okay to go to that level if you need to, but you know, then eventually you want to back it. You know, your goal for any treatment, it doesn't matter if it's a natural product or a prescription, is you want to use the lowest dose that actually works for you. Okay, so you need to make sure you take a dose that works. Taking a dose that's too low to work is useless. Okay, but make sure that whatever dose you're on is working, but then you try to lower as much as you can. And that's just standard therapies.
And we will be going up to 12 a day in the study as part of that ramp-up protocol that I mentioned earlier. So we will be doing 6, 9, 12, similar to the dosage that we currently recommend as part of this study, if they can make it up to the 12 capsules a day, and then ramping back down. So.
There's one that just came up. I'm living in Peru. Where can I get pills? You can order them online from Desert Harvest.
Yes, you can. We do have some international suppliers, especially our one in Australia, that actually ships much easier than, and probably a little bit cheaper in shipping than ordering on our website. But it is, if you go to our website and go under shop, there's an international tab, and you can take a look at all the different places you can buy internationally as well. And there is a big difference between the capsules and a aloe vera liquid. There's a lot that goes into the processing that changes the nutrients in a juice. Unfortunately, there's only 2 ways to actually preserve a juice. If one is with bladder irritating preservatives, and 2 is pasteurization, which means you're just drinking really expensive water at that point. There is no nutrients left in that. So if you do drink an aloe vera drink and it doesn't bother your bladder, it is probably pasteurized. So we really do not recommend or even make a juice for those very reasons.
Yeah, I mean, I would just add that my personal experience with other forms of aloe has been, like you said, just not really successful. Either they've gotten sick or they've gotten no response. So I don't think there's a real alternative aloe preparation that I know of that's comparable. So I really am not a fan of the juice. I don't think it works. Someone just asked a question: relation between IC and UTIs, and the answer is no, not really. You know, we for decades actually we've looked for links between IC and some form of a microorganism. And there is some ongoing research in this area that I'm involved with because of new information we have about the microbiome. And I think we're learning that what we thought many normal people had sterile urine. The answer is nobody has sterile urine, but the amount of bacteria can be very low. I think that the bottom line is we don't know of any connection between IC and any form of UTIs, but there may be some alterations in the microbiome of IC patients that makes them somehow different from normals. That remains to be seen. I think the end result, though, is there's no appropriate antibiotic therapy that would impact interstitial cystitis.
And Linda has asked, is the study aloe the same aloe that we are currently selling on the website? The answer is yes. And Amy asked where she can find that dosage schedule. If you go on our website, at the top it says learn, and then under there at the very bottom it says aloe vera recommended dosage. That's where you can find that dosage protocol. And if you are looking for the aloe, Rosalina, you'd mentioned the Desert Harvest calcium and vitamin D3. That is something that can be taken in conjunction, but you would specifically be looking for the Desert Harvest Super Strength Aloe Vera capsules.
Right, and someone just asked if it was freeze-dried, and it is yes, it is freeze-dried.
And Kate asked about lowering the dosage. So if you do go to our website under that Learn Dosage Protocol, it is about lowering, it's about taking a capsule away for a week is what we recommend. And you'll see that whole maintenance dose there. So if you're on 6 a day for a week, take 5. If you do good, the next week go down to 4. If you feel any of your symptoms return to that previous dosage. You're going to know your body best and kind of listen. But definitely that maintenance dose protocol and following that's there on our website will help you there, Kate. And let's see. All right. I think.
Sorry, I lost it, but I'm back. Oh, hold on. I think I'm back now. Okay.
Okay. I think we have gotten through everything, Dr. Evans. It looks like we have answered. Definitely, if you have more questions, I'll keep an eye on here, and I'll see if I can answer some. And if not, I can defer those questions to Dr. Evans via email and.
Yeah. There's one question that came up, and it's which I can address. A couple of them. One is, can you take it if you're still taking Elmaro? Yes. There's no drug that you have to give up to be on this. You just can't do installations and hydrodistensions, but drugs are all fine, okay? There's a question about Tramadol. No, you don't have to come off Tramadol. Again, if you're on a standard dose that you don't change and you leave it alone, we're trying to make this as simple as possible. So any drug, literally any drug you can take, just as long as your dose is stable. And on that regimen, your pain score is 4 or higher, okay? There's a good question about gastric bypass. We had not thought about that. There's always a question in people with gastric bypass, do they absorb medication well? But we had not put that in as an exclusionary criteria. So, I would have to say probably at this point, unless we decide we have some other evidence to the contrary, you probably could enroll. And there was a question, is it ever going to be covered by insurance? And the answer is, products that are not sort of under FDA control and considered food supplements, which this would fall into that category, are not covered by insurance. And I don't foresee that changing. To be honest with you, given the expense of some of the medications that are FDA controlled, I'm not sure that you're not better off with the way this is, have it not be covered.
Yeah. When you compare it to drug costs, definitely. I think someone recently posted on Facebook, I think their Elmaro was $300 or something like that without insurance. So definitely compared to like the $68, we do have a variety of programs, and we even have a compassionate assistance program for those where that are financially in need and can get it 50% free depending on financial circumstances. And all of that information is on our website because we want to make sure no one goes without it if they want it.
Yeah. And there's one question, is it only available online? And I think the answer to that is yes, that's the way. But that's a really good way to have it because I think it keeps the middleman down. It keeps your costs down.
Mm-hmm. Yeah, we have not had to raise our costs in over 20 years by doing that. I know everybody would love, well, I don't know right now. I wouldn't want to go to the local store that very often, but, you know, in theory and practice, you know, going here or there, but that would cause us to have to raise costs. And we have tried to keep them low for a very long time and not raise costs for that very reason. So. All right.
Okay, one question, and we've been over this several times. You had your bladder extended 3 weeks ago. Can you participate? No, you cannot. You need to be for what we said, it's 12 weeks, I think, from a hydro distension. And so when your time to enroll, if you're 12 weeks out or more, and you don't have any other hydro distensions during the entire study, and your pain score is over 4, but those exclusionary criteria are very strict. They're in there for a reason. We can't bend or break because it will give us bad data. And, you know, the thing is we like to prove that this medication is as effective as we think it is. And if we screw it up, then we don't get that data. So I've been involved in an awful lot of IC trials over the years that ended up having issues because of poor patient selection. So someone's getting repeated hydrostensions is not going to be enrolled.
And Sheila asked, is it necessary to take on an empty stomach? And the answer to that is no. You can take it with or without food. It does not affect the absorption. However, we do have some people that do like it to take it with food just for stomach sensitivity. This is a high nutritional content. And just with a lot of other supplements that have high nutritional content, they can sometimes cause stomach upset for some people. And that we do recommend taking it with food or adding a calcium and vitamin D3 if that is the case.
Yeah, there was this is a question, and for everybody is asking, can you do this with another dot? The answer is no. This is a pilot study. It's just me, okay? And you know, you have to understand, we're trying to get data that supports this product, okay? And it has to be done right. So you can't start with somebody else. You can't do that, okay? You have to come to be enrolled. That's just, if you can't get to North Carolina, then just take the drug on your own and don't go in the study. That's okay. You can do that. If you want to be in the study, you have to be seen and appropriately evaluated to make sure you're a candidate. Nobody else is involved with this, not yet.
And I know, Lee, you probably got to get this launch going here for the rest of the walk here in a few minutes. We went a lot longer than we said we were going to. So we can kind of hand it back to you. And definitely all of this information will be on our website, on the ICA's website. Maybe if we want to post the phone number again, Nikki, just so you see it, where they can call Dr. Evans' office on starting Monday to see about enrollment. And then if you have any other further questions, you're always welcome to also call us at Desert Harvest as well, if you want to post that as well, Nikki.
Great.
Absolutely. Yep, that's right, Heather. And thank you so much, Dr. Evans. We really appreciate you coming on and sharing about this great new study and being available to answer all these questions. It's so great. I know that our people really, really want to be able to have answers to questions. And so this is a great session for those folks. Thank you so much to Heather and to Desert Harvest for being such a wonderful partner to ICA and for sponsoring this event, and as well as a few of our other events coming up. And as she said, what we're going to do, actually, ICA will post the info on our website, but we will also send a follow-up email out to everybody who registered. We'll include a recording of today's session. We'll also include the inclusion-exclusion information that was shared at the top of the hour, as well as the phone numbers that we talked about for both Dr. Evans and for Desert Harvest and all of that. So look for that from us. And then Nikki, would you mind putting up that final slide if you can? I just want to remind everybody, as Heather mentioned, we're launching our first ever virtual walk today, and our website, I'm not sure if you can see it or not, is on this slide. If not, you can go to our website, www.ichelp.org, to register for the event. If you're able to participate, that would be great. And if you can't, please consider making a donation to ICA so that we can continue to provide this great information to our community. So I think that wraps it up. Again, thank you so much, Dr. Evans. Thank you so much to Heather and Desert Harvest. And thanks to all of you for joining us today. And happy IC Awareness Month. Thank you so much.
Thanks, Lee.